So welcome to our self-care class. So this week we're going to do something a little bit differently and probably in the following weeks too. So there's this workbook by Jeff Riggenbach called Cognitive Behavioral Therapy Toolbox. So I think it's really interesting. He's had some topics about stress, anxiety, and self-esteem, which I think stress and anxiety is probably a good thing for us to focus on during this time. So for the next couple of weeks, we're probably going to be just kind of diving into this book. So if you want to get the book, it's your choice. It doesn't mean you don't have to if you don't want to. So it's called the CBT Toolbox, a workbook for clients and clinicians by Jeff Riggenbach. And this is what the book looks like. You get it on Amazon. Probably Barnes & Noble or anywhere else that you can get books from. So I'll just do a little background about what is cognitive behavioral therapy, and just to kind of abbreviate, so I'm not saying this big, huge word all the time. So we also go by CBT. So it's a common type of talk therapy, like we call it psychotherapy. So you work with a mental health counselor or a psychotherapist or a therapist in a structured way, and it's usually attended in a limited number of sessions. And what the point of CBT is to help you become aware of inaccurate or negative thinking so you can view challenging situations more clearly and respond to them in a more effective way. Cognitive behavioral therapy is used to treat a wide range of issues. It's often the preferred type of psychotherapy because it can quickly help you identify and cope with specific challenges. And it also generally requires fewer sessions than other types of therapy and is done in a structured way. CBT may not, the one thing to keep in mind is CBT may not cure your condition or make an unpleasant situation go away, but it can give you the power to cope with your situation in a healthy way and to feel a bit better about yourself and your life. And this information is by from the Mayo Clinic. So some mental health disorders that may improve with CBT include depression, anxiety disorders. It's been used with phobias, PTSD, sleep disorders, eating disorders, obsessive compulsive disorders, OCD, substance use disorders, bipolar disorders, schizophrenia, and also some sexual disorders too. In some cases, CBT is the most effective when combined with other treatments such as antidepressants or other medications. So it usually does work better if it's combined with other treatments too. So steps in CBT. So this is kind of like a kind of overview of what type of techniques is used. So steps in CBT. So identify troubling situations or conditions in your life. So these maybe include issues as a medical condition, divorce, grief, anger, or symptoms of a mental disorder. You and your therapist may spend time deciding what the problems and goals you want to focus on. So it's really focus on like goals too that you guys come up with. It also helps you become aware of your thoughts, emotions, and beliefs about these problems. So once you identify the problems to work on, your therapist will encourage you to share your thoughts about them. This may include observing what you tell yourself about an experience, such as self-talk, your interpretation of the meaning of a situation, your beliefs about yourself, other people, and events. And your therapist may suggest that you keep a journal of your thoughts. So this does kind of require some homework on the client's part as well. So just to keep in mind with that. So I'll stop there right now and I'll go over more in the next part.